81. What is the priority action for a nurse when a 7-year-old child with sickle cell disease has swelling in the hands? Answer: notify the provider and administer prescribed analgesics. Rationale: swelling indicates dactylitis, requiring pain management and evaluation, per AAP sickle cell guidelines. 82. What should the nurse do when a 3-year-old child is afraid of the dark in the hospital? Answer: provide a nightlight and comfort item. Rationale: nightlights and comfort items reduce fear, per pediatric nursing standards. 83. What is the best action for a nurse when a 10-year-old child with asthma has wheezing? Answer: administer a rescue inhaler and assess lung sounds. Rationale: wheezing indicates bronchoconstriction, requiring a bronchodilator, per NAPE guidelines. 84. What should the nurse do when a 1-year-old infant has a positive Babinski reflex? Answer: document the finding as normal for age. Rationale: a positive Babinski reflex is normal in infants under 2 years, per AAP developmental guidelines. 85. What is the priority action for a nurse when a 5-year-old child with a head injury has a seizure? Answer: administer prescribed anticonvulsants and protect the child. Rationale: seizures risk injury, requiring immediate control, per AAP head injury guidelines. 86. What should the nurse do to promote hydration in a 2-year-old child with vomiting? Answer: offer small sips of oral rehydration solution and monitor output. Rationale: small sips prevent dehydration and monitoring tracks recovery, per AAP gastroenteritis guidelines. 87. What is the best action for a nurse when a 9-year-old child with cystic fibrosis needs pancreatic enzymes? Answer: administer enzymes with meals and snacks. Rationale: enzymes aid digestion, preventing malabsorption, per Cystic Fibrosis Foundation guidelines. 88. What should the nurse do when a 4-year-old child with a fever is lethargic? Answer: notify the provider and assess neurological status. Rationale: lethargy may indicate serious infection, requiring evaluation, per AAP fever management guidelines. 89. What is the priority action for a nurse when a 6-month-old infant with RSV has a temperature of 103 degrees Fahrenheit? Answer: administer acetaminophen and monitor respiratory status. Rationale: high fever worsens respiratory distress, requiring antipyretics, per AAP RSV guidelines. 90. What should the nurse do when a 12-year-old child with diabetes needs insulin education? Answer: use visual aids and involve the child in self-care. Rationale: visual aids and involvement promote understanding, per ADA guidelines. 91. What is the best action for a nurse when a 3-year-old child with a burn has poor appetite? Answer: offer high-calorie snacks and consult a dietitian. Rationale: burns increase caloric needs, requiring dietary support, per AAP burn care guidelines. 92. What should the nurse do to promote safety for a 5-year-old child in a wheelchair? Answer: ensure the wheelchair fits and teach safe use. Rationale: proper fit and education prevent injuries, per AAP safety guidelines. 93. What is the priority action for a nurse when a 7-year-old child with leukemia has petechiae? Answer: notify the provider and assess for bleeding. Rationale: petechiae indicate thrombocytopenia, requiring evaluation, per AAP oncology guidelines. 94. What should the nurse do when a 1-year-old infant is not babbling? Answer: refer to a speech therapist and assess hearing. Rationale: lack of babbling may indicate developmental delay, requiring evaluation, per AAP developmental guidelines. 95. What is the best action for a nurse when a 10-year-old child with asthma is exposed to a trigger? Answer: remove the child from the trigger and administer a rescue inhaler. Rationale: removing triggers and using a bronchodilator prevent exacerbation, per NAPE guidelines. 96. What should the nurse do when a 4-year-old child with a fever has a rash? Answer: assess for communicable diseases and notify the provider. Rationale: rash with fever may indicate measles or meningitis, requiring evaluation, per AAP infectious disease guidelines. 97. What is the priority action for a nurse when a 6-month-old infant with heart failure has edema? Answer: notify the provider and administer prescribed diuretics. Rationale: edema indicates fluid overload, requiring diuretics, per AAP Congenital Heart Disease Guidelines. 98. What should the nurse do to promote comfort for a 3-year-old child with otitis media? Answer: administer prescribed analgesics and apply a warm compress. Rationale: analgesics and warmth reduce ear pain, per AAP Otitis Media Guidelines. 99. What is the best action for a nurse when a 9-year-old child with sickle cell disease is dehydrated? Answer: administer 4 fluids as prescribed and monitor electrolytes. Rationale: dehydration exacerbates crises, requiring fluids, per AAP Sickle Cell Guidelines. 100. What should the nurse do when a 2-year-old child is anxious during a hospital stay? Answer: provide a comfort item and encourage parental presence. Rationale: comfort items and parents reduce anxiety, per Pediatric Nursing Standards. 101. What is the best action for a nurse when a 4-year-old child with asthma is wheezing during play? Answer: administer a rescue inhaler and rest the child. Rationale: wheezing indicates bronchoconstriction, requiring a bronchodilator and rest to reduce respiratory demand, per National Asthma Education and Prevention Program, NAEP, Guidelines. 102. What should the nurse do when a 6-month-old infant with a fever is not feeding well? Answer: notify the provider and assess for dehydration. Rationale: poor feeding with fever suggests illness or dehydration, requiring evaluation, per American Academy of Pediatrics, AAP, Fever Management Guidelines. 103. What is the priority action for a nurse when a 3-year-old child with gastroenteritis has bloody diarrhea? Answer: notify the provider and obtain a stool culture. Rationale: bloody diarrhea may indicate bacterial infection, requiring diagnostic evaluation, per AAP Gastroenteritis Guidelines. 104. What should the nurse do to assess a 5-year-old child's developmental milestones? Answer: observe play and ask about language and social skills. Rationale: play and parent reports assess cognitive, motor, and social development, per AAP Developmental Guidelines. 105. What is the best action for a nurse when a 10-year-old child with leukemia is afraid of chemotherapy? Answer: explain the procedure using simple terms and use therapeutic play. Rationale: age-appropriate explanations and play reduce fear, per AAP Oncology Guidelines. 106. What should the nurse do when a 2-year-old child with a seizure disorder is prescribed valproic acid? Answer: monitor liver function and educate parents about side effects. Rationale: valproic acid can cause hepatotoxicity, requiring monitoring and education, per Epilepsy Foundation Guidelines. 107. What is the priority action for a nurse when a 7-month-old infant with RSV has retractions? Answer: administer oxygen and notify the provider. Rationale: retractions indicate severe respiratory distress, requiring oxygen and urgent evaluation, per AAP RSV Guidelines. 108. What should the nurse do when a 4-year-old child refuses to use a nebulizer for asthma? Answer: use a playful approach and demonstrate on a toy. Rationale: playful methods reduce resistance, improving compliance, per Pediatric Nursing Standards. 109. What is the best action for a nurse when a 12-year-old child with diabetes has a blood glucose of 400 milligrams per deciliter? Answer: administer insulin as prescribed and monitor for ketoacidosis. Rationale: hyperglycemia requires insulin and monitoring for complications, per American Diabetes Association, ADA, Guidelines. 110. What should the nurse do when a parent reports a 3-year-old child was bitten by a dog? Answer: clean the wound and assess for infection or rabies risk. Rationale: cleaning prevents infection and assessment guides treatment, per AAP Injury Guidelines. 111. What is the priority action for a nurse when a 9-year-old child with sickle cell disease has chest pain? Answer: notify the provider and administer oxygen. Rationale: chest pain may indicate acute chest syndrome, requiring oxygen and evaluation, per AAP Sickle Cell Guidelines. 112. What should the nurse do to promote nutrition in a 1-year-old infant with failure to thrive? Answer: offer high-calorie foods and consult a dietitian. Rationale: high-calorie foods support growth, and dietary expertise addresses deficiencies, per AAP nutrition guidelines. 113. What is the best action for a nurse when a 6-year-old child with a burn reports itching? Answer: administer prescribed antihistamines and apply moisturizer. Rationale: itching is common in healing burns, requiring relief to prevent scratching, per AAP burn care guidelines. 114. What should the nurse do when a 5-month-old infant has a weak cry? Answer: notify the provider and assess neurological status. Rationale: a weak cry may indicate neurological or respiratory issues, requiring evaluation, per AAP assessment guidelines. 115. What is the priority action for a nurse when a 4-year-old child with croup has stridor during sleep? Answer: administer nebulized epinephrine and monitor respiratory status. Rationale: stridor indicates airway obstruction, requiring epinephrine, per AAP croup guidelines. 116. What should the nurse do when a parent asks about the flu vaccine for a 2-year-old child? Answer: educate about benefits and schedule the vaccine. Rationale: the flu vaccine prevents severe illness, per Centers for Disease Control and Prevention, CDC. Immunization guidelines. 117. What is the best action for a nurse when a 10-year-old child with cystic fibrosis has weight loss? Answer: assess dietary intake and consult a dietitian. Rationale: weight loss indicates malabsorption, requiring dietary adjustment, per Cystic Fibrosis Foundation guidelines. 118. What should the nurse do when a 3-year-old child is anxious during a physical exam? Answer: allow a comfort item and involve the parent. Rationale: comfort items and parents reduce anxiety, per pediatric nursing standards. 119. What is the priority action for a nurse when a 6-year-old child with a head injury has confusion? Answer: notify the provider and perform a neurological assessment. Rationale: confusion suggests brain injury, requiring urgent evaluation, per AAP head injury guidelines. 120. What should the nurse do to promote safety for a 2-year-old child near a pool? Answer: educate parents about constant supervision and pool fencing. Rationale: supervision and fencing prevent drowning, per AAP safety guidelines.